We are so happy to begin a new series here at ABC4 with our partners of Intermountain Healthcare called Healthy Choice. And today, physical therapy can change injuries. And today in our new sponsored segment, Aaron Swalberg joins us from Intermountain Tosh Physical Therapy. And everyone wants to be active and pain-free, yet millions of people suffer through it. And physical therapy may be one of the answers.
Absolutely. Physical therapy, typically an evaluation with a physical therapist takes about 30 minutes to an hour. We go over things like posture, flexibility, strength, motion, try and identify some contributing factors to a person's problem.
Well-being and recovery, too.
Exactly.
So can you tell us the difference between someone who may not go through physical therapy and the recovery you can get through so much faster when you do physical therapy?
You bet. A good example would be low back pain. Often low back pain is this
possible chronic pain, potentially.
Exactly. Diagnosis that is not specific, and so often a visit with a physical therapist can help direct where a person needs to start, and physical therapy has been shown to reduce the incidence of opioid use or other procedures that might not need to happen.
That's such a good point, because we do think of going to physical therapy after an accident, after maybe a leg injury, things like that. But if you are suffering from chronic pain, this may also be something that a physical therapist can really alleviate.
Absolutely, in a conservative way, without the use of medications or other procedures that might actually be detrimental in the long run.
Have you seen instances where people have gotten through chronic pain and after physical therapy, you know what, I don't need those opioids?
Absolutely. In fact, oftentimes it's just teaching a person how to exercise. Some of these things that we know we're supposed to do, but we may not know how to with the type of pain that we have. We can help coach a patient or a person through that process.
And also getting that physical therapy can help in terms of maybe less pain in the future, and it can benefit recovery period.
Absolutely. Prevention is a huge part of what we do.
Yeah. So if you know someone who is going through maybe after surgery, how many, I know it varies, but how many times should we be committing to physical therapy?
You know, it doesn't need to be many. In fact, our goal is to get a person on an independent program, something that they can do on their own at home or at the gym. And so it doesn't need to be an extensive bout of therapy. And
something like avoiding surgery in the first place, that's interesting too.
Absolutely.
By doing physical therapy. How so?
For example, a person has an acute episode of low back pain. Their first thought is, this is horrible, this is something I need to go see the surgeon for. Well, often those can be addressed in a conservative way with some evidence-based treatment that can help avoid that escalation.
That next step. And also, even physical therapy doesn't mean a huge commitment, right? Sometimes these exercises, maybe 10 minutes that you can take because of the pain, and maybe a couple times a week, you think?
Yeah, absolutely. Just establishing a program that can work with a person's normal lifestyle. And
you don't always need a referral, which is a big step of getting people in the door.
True. There are some insurances that do require referrals. For instance, Medicare requires a referral from a physician, but no, a physical therapist can see a patient without a referral.
Excellent. So if you want more information, and if you think that this might be the therapy that you need, go to intermountainhealthcare.org. You can find answers there, and of course at Tosh as well.